Welcome to Know My Breast Cancer Risk. I am David Decker, a medical oncologist and creator of this site. I have been involved with the prevention, diagnosis, and treatment of breast cancer for over 35 years. On this site, you will learn your risk of developing breast cancer. If your risk is high, you will find recommendations for early detection and proven methods to decrease your risk. The United States Preventative Services Task Force, along with other national organizations, recommends that women over the age of 35 have their risk of developing breast cancer determined. For those at high risk, risk reduction consultation with a healthcare provider is recommended. This program was developed to empower women and their healthcare providers to meet this standard. This program has 17 questions that can be answered by the vast majority of women without any help from medical personnel. After completion of the questionnaire, you will receive your 5-year risk of developing breast cancer, lifetime risk of developing breast cancer, and if genetic counseling is necessary because of a possible family history. An explanation of how your breast cancer risk was calculated is provided. Suggestions are made for future breast cancer screening. For those with a family history that suggests an inherited breast cancer, genetic counseling is recommended. For those at a high 5-year risk or lifetime risk, the benefits of risk reduction medication along with their side effects are described. For those at an increased risk who desire more information, breast cancer risk reduction educational information is provided in an ebook titled Breast Cancer Risk Reduction Educational Material. This book has 4 chapters. The Genetic Risk of Breast Cancer chapter describes genetic counseling for those with a family history and the nature of breast cancer prevention in women who carry an abnormal gene. The Risk Reduction Medication chapter describes medications that will decrease the risk of breast cancer by 50% with 5 years of therapy and about 30% for the next 15 years without additional therapy. The Management of Menopausal Symptoms During Risk Reduction Therapy chapter describes methods to control menopausal symptoms while on risk reduction medication. The most common reason for women not taking these medications is menopausal symptoms. The Alternatives to Risk Reduction Medication chapter describes other proven and unproven methods to decrease the risk of breast cancer. This ebook can be downloaded to your email address. There are some individuals that should not participate in this program. Women with a prior history of breast cancer or those with a known genetic abnormality that causes breast cancer as BRCA1 or BRCA2 should not participate in this program. Furthermore, this program will not estimate the 5-year or lifetime breast cancer risk for those less than 35 years or those older than 85. For those less than 35 years, the program will tell you if genetic counseling is necessary. The information in this program is not designed to substitute for an evaluation and recommendation by your primary care provider. Instead, it is designed to provide you with educational information to share with your primary healthcare provider. Together, an individualized program to prevent or find breast cancer early can be designed.